From the Skyterra Wellness Retreat, this is the Inspired Intentions Podcast, where we help people build the skills and mindset to live a healthy life. Hey everyone, before we dive into today's episode, if you've been enjoying our podcast, take a moment to rate and review. It may seem like a small thing, but our ratings and reviews make a huge difference in the quality of our show. They help us reach more listeners like you so we can continue bringing you more amazing content. So, if you've found inspiration, learned something new, or just love tuning in every week, please rate the Inspired Intentions Podcast 5 stars and leave us a review and even share with a friend. We truly appreciate each and every one of you. Now let's get into the show.
Listeners, as you know, my co-host Alan, even when he's not on the mic, he is always in the booth, which is a great thing, I think. And right before we were starting to record this episode, he let me know something really, really neat, which is we have a past guest named David. Hi, David. We haven't met, but I've heard wonderful things about you. And I heard that you had a great idea to record a podcast about Chinese medicine, which, believe it or not, we had already been planning to do. And so I think you are maybe connected with all of us here at Skyterra. And thank you for the idea. And that's exactly what we are doing today. And I am so excited to introduce Dr. Wheatley to the podcast. This is your first time on our podcast. Hi, Dr. Wheatley.
Hi, how are you?
I'm so good. How are you doing?
Doing really well. Happy to be here.
I'm so happy that you're here, and I feel like we're going to have a really great episode and a great time together. David knows you, of course, Alan knows you, and I know you, but for our listeners, could you please introduce yourself and your background and what you do here at Skyterra?
Hi, my name is Dr. Wheatley Posey. I am a board-certified acupuncturist and doctor of acupuncture and Chinese medicine. I've been practicing for about 6 years now. Got my doctorate in Asheville, North Carolina at Taoist Traditions. I've been at Skyterra for coming up on a year and a half.
Wow. And how do guests get to interact with you when they're here at Skyterra?
There's a couple different ways. So they are welcome to book an appointment with me up at the spa, or I've started to have a broader audience being able to teach the fundamentals of Chinese medicine, one of our new classes here at Skyterra.
Wonderful. Oh, that's wonderful. So today, like I said, we're going to talk about Chinese medicine. And could we just maybe start really broadly? What is Chinese medicine?
What a question.
Just dive right in.
Let me just tell you, Chinese medicine, it's really, really fascinating because not only is it this medical system, but it's also a medical philosophy sort of intertwined into each other. And we utilize both of those concepts to treat our patients as holistically as possible. So really broad strokes of just the fundamentals of Chinese medicine. So there's this idea of yin and yang, and I remember being a product of the 90s, seeing the yin-yang symbol kind of everywhere.
Yeah.
And as a very proud Appalachian, it was yin and yang. So I remember thinking it was this idea of opposing forces or opposites attract kind of thing. And it's more correct to think about yin and yang in terms of these mutually consuming and interdependent parts of one entity. And so when you think about yin, you can think about it in terms of your structure or your anatomy. When you think about yang, you can think about your physiology or how we utilize those resources, our functionality. So yin and yang are these entities. One is who we are, and the other is what we do with who we are. I like to, so that concept is kind of a primal way that physicians would look at you. Okay, is it a yin deficiency or is it a yang deficiency? An example of a yin deficiency would be As somebody who knows very, very little about cars, I like to use a lot of automobile metaphors. And one of those is a yin deficiency, which would be somebody gets into their vehicle and they're 8 weeks past due for an oil change, but they're pedal to the metal all the way to California. We know that whether the engine starts blowing out black smoke or not, the vehicle's running hot.
Mm-hmm.
And it's not because there's excess heat. It's because there's a lack of something. There's a lack of yin. There's a lack of oil. Whereas a yang deficiency would be someone who inherits a vehicle. It sits in your carport for 6 months, goes all winter, nobody's running it. You go to start it, it doesn't start. It's been sitting in the cold and not in motion. So you need to bring in an outside source of chi or motion to jumpstart the yang, to get our energy going again. So that's a yang deficiency. So again, that might be a question that Chinese medical physicians and acupuncturists are asking themselves as we have patients come in with a chief complaint. Okay, do we need to put oil into the tank or do we need to jumpstart the battery?
Got it. And what are the benefits of Chinese medicine?
Another really great question. Really, really, really vast. You could go anywhere from treating poison ivy to sciatic pain to broadening neurological pathways. It depends on what the patient is presenting as and what their symptomology is. But within Chinese medicine, there are several medical modalities that we work with. So cupping therapy or gua sha, which is skin scraping, these are more designed for acute pain conditions where we're moving blood at the superficial level, somewhere between the skin and the muscle, breaking up myofascial adhesions, stopping pain, reducing muscle tension, reducing inflammation. With herbal medicine and acupuncture, say you have a digestive disorder, we might choose herbs like Fuling and Rinchen and Poria, all herbs that are designed to harmonize the spleen channel and the stomach channel. Whereas if we're dealing with more emotional health, we might choose acupuncture points that have the energetics to calm the spirit, like Rin 6 and Rin 12, Spleen 6 and Yin Tong, these things that really open up the channels that might have stagnant blood. Something that I really, really, really love about Chinese medicine is that it shows how the emotions move through the blood. So stress constrains our blood. Anger raises our blood, puts heat into our blood. Anxiety knots the blood. Fear scatters the blood. And so we have these ways of not only knowing, yes, the blood flow, the circulation isn't moving well, but why? And how is it moving now? And what do we do about that? And acupuncture has these very specific locations to do those very specific things.
So, Dr. Whitley, one of the interesting things I was just thinking, you are such a practitioner of Chinese medicine that you are thinking and talking in Chinese, which is interesting. And you did not, I'm assuming, grow up in China. It sounds like you're from the Appalachian area. How did you get into Chinese medicine, and what makes it so different from Western medicine? And maybe, I don't know anything about your background, but I think it would be really interesting to hear that.
Yeah, thank you for that question. You get to, and I'll answer that question, but just to speak what you've said, a lot of the times a known thing in Chinese medical school is that you will spend the first 2 or 3 years understanding the language or just being exposed to the language, and the next 2 or 3 years practicing as an intern, because it is Chinese medicine is a different medical model, like we talked about earlier, but it's also an entirely different language. It's a different way of thinking about the body. I got into Chinese medicine through Western healthcare. I was in radiology and radiation therapy, and I was doing clinical work in our hospital systems here in Asheville in Western North Carolina. And something that I noticed that I think maybe a lot of other people who get to Chinese medicine also notice is Western care is profoundly good at looking at pathology, zooming in and eradicating it. And we do that by specializing within a specialty, within a specialization of a specialty, within a specialization of that specialty. And that's why it's really good. We can get to this microscopic level and see in our blood work, what is going on. Whereas Chinese medicine zooms out and zooms out and zooms out until we look at a person as an entire ecosystem. And our idea of health is that symbiotic relationship within ourselves, but then also with the environment we're in as well. So from radiation therapy straight into Chinese medicine, yeah.
Was there a turning point in your life when you had been exposed to it and you wanted to take this different path?
No, absolutely not. In fact, I remember coming home from a hospital in Clyde, North Carolina, and just feeling very small. Like you're so little in this massive system, because I found myself wanting to spend more time with my patients, wanting to get to know them, because you get to know this small little part of their life. But I wanted to know everything, because something that I saw, especially in radiation therapy, is that you get to spend time with these people for every day, maybe 2 weeks, maybe 6 weeks, maybe 8 weeks. And then that's it. You don't know how their recovery is. Do they get into preventative care? Do people know what their story was? I'm not going to cry. Do people know what they've been through? Because it matters. It matters a lot. So I got lost in that answer.
No, you're fine. That's beautiful. Thank you. Thank you for sharing that with us. Alan and I work with a team of people who help us with this podcast. And one of the things that they do is they'll let us know when certain terms or subjects are trending, and we'll try to do a podcast on them. So when I reached out to you originally about doing this episode, we had proposed a couple of different topic ideas related to Chinese medicine. We had talked about cupping, and one of our ideas was just in general how Chinese medicine relates to Skyterra's 5 pillars of wellness. And that was, you immediately said, you were so lovely. I'll do whatever you want. And
I love a pillar. A pillar.
And just the relationship between Chinese medicine and your specialty and what we teach here at Skyterra. And I know we talk about this, listeners, on our podcast all the time, but if this is your first episode that you're listening to here at Skyterra, we have 5 pillars of wellness that we base all of our programming around. And those 5 are movement, making sure that you move your body and exercise your body; nutrition, making sure that you're eating food that fuels your body; play, having fun; rest and sleep; and mindfulness. So being mindful of just your life and, not going through life on autopilot. So how do those 5 pillars tie in to Chinese medicine?
I love this question. It's the question that brought me here today. I love that question because it really, not only does it mirror something that Chinese medicine and Skyterra both do really, really well, is meeting patients and guests exactly where they are. but it also beautifully mirrors the 5 elements of Chinese medicine too. You have the fire element, which belongs to the heart, and it belongs to, or it's responsible for creativity. And then you have the earth that's responsible for digestion. Yes, what we eat matters, but why we eat what we eat and how we eat matters, and that mindfulness component that comes in. And then you have the metal element, belongs to the lung channel, has an affinity for structure and organization. Seasonally, the lungs are in line with autumn. So the structure comes from, okay, what are we letting go of? What are we holding on to? And the really dense beauty of what it's like to grieve as well, whether that's grieving the last year and the beauty in letting go of what we no longer need. And then you have the water element, which is the kidney channel, mindfulness, stillness, winter, darkness, reflection. Then you have wood, which is my favorite channel, and we're coming into it soon, the liver channel, and our productivity, our dreams. What are we going to do with what we have? And Chinese medicine has an order for all of those things. One begets the other. And guests at Skyterra are some of my favorite people because they're so ready to change. They're so excited. They're here with ample hope. But everybody looks so different. Some people require more rest. Some people require more movement. Some people require more play. A lot of that has to do with and is measured by, at least in Chinese medicine, your constitution and your environment, your health history, what brings you joy, your relationship with your work and your free time and your family and all of that. Nothing's off the table. My medical intakes tend to be quite long.
What do guests typically come to you seeking help for?
So typically at Skyterra, I found a lot of guests coming for hormonal balance. So that would be within the category of endocrinology, or as one of my professors likes to put it, the psycho-neuro-musculoskeletal respiratory cardiovascular gastric immunohepato-renal endocrine system.
Which is the longest word we've ever said on this podcast.
You're welcome. And I remember her saying that because the endocrine system is just so vast and everything's connected to it. We think about our fight or flight hormones, the norepinephrine and the adrenaline, and when those get taxed, how it can be a slow cortisol drip. So acute versus chronic, and how we hold that in the gut, and how the immunity lives in the gut. And so it's all quite connected. So to say the endocrine system is also to say that everything's quite treated there.
Okay. And then typically at Skyterra, our guests, I think our average length of stay is around 2 weeks, but guests come certainly for a shorter amount of time and they stay for longer. But what are you able to do for guests who are at Skyterra for only a relatively short amount of time, a week or two?
I cannot tell you how many times I've asked people to just move here. Do you just want to be in Western North Carolina? You could just move in. But yeah, that's a great question. And in order to really answer it effectively, I want to talk about these 3 levels in Chinese medicine, or these 3 areas that we can treat based on how deep the patient wants or needs or is required to go. So in Chinese medicine, we have the most superficial level called the Wei Qi, W-E-I, the Wei Qi. It's sort of in line with our immune system. So our skin, what's just under the skin, acute pathology. So treating at the Wei Qi is treating musculoskeletal pain, sports medicine types injuries, common cold, that sort of thing, where we're really sort of invigorating the Wei Qi, the immune system, muscle tone, that sort of thing. Whereas the Ying Qi, Y-N-G, Y-I-N-G, the nutritive level is a little bit more about preventative care. At this level, we're working with gut health, we're working with autoimmune disorders, emotional, mental health, these sorts of things that didn't come on a week or two ago, that we've been dealing with for 3 months minimum. Working at the Qi level is working in a chronic capacity. So it's something that has much more to do with the health and tonicity of the vital organs, and not simply the musculoskeletal level. And then the last level would be the Yuan Qi, and this is the deepest level. This is what Chinese medicine calls our essence, or our Jing. And this is the level that we're dealing with genetics. We're dealing with what you came into the world with, and how your environment has affected it, how you've dealt with your genetics or your ancestry. There's a huge emphasis on ancestral trauma right now, but I like to talk about ancestral power a lot more.
I love that.
And just-
Ancestral power.
Yes. What are you doing with that ancestral power? And there's a lot here in Appalachia. We're a powerful bunch. So another reason I want people to move to the medicinal mountains of Brevard too. But so that's that level. It's quite deep. You're dealing with your bones. You're dealing with, your genetics.
So how you work with our guests is maybe one or two or all three?
That's a great, yes.
Yeah.
Yes. So in
Yeah.
a word, after we do our medical intake, which normally takes about an hour, sometimes a little bit more than that, we'll go over everything together and figure out, based on the time that you have here, what floor do we need to get off on? What do we need to do? Because I like to fortify guests with as much information and parallel it to Western care that I can, so that they can take the medicine home with them. Yes, a lot of times you need herbal medicine or acupuncture or changes and modifications to nutritional therapy. But if I can give them the tools that they need to leave here with, and utilize outside sources very little, and have the answers that they need inside. Because at the end of the day, we're our own best doctors. So I've been given the education to be able to see, this is the root, these are the branches. But only somebody who knows themselves really well and can look out for these things can take that medicine home with them. And that's where I prefer to go with it, no matter what level.
What kind of differences do people notice after they've worked with you?
Yeah, so immediately in Chinese medicine, we have slang called you wake up from your acu nap. You're a little bit groggy, a little bit reaching nirvana. You can feel, but that acu nap comes from a place of regulating the nervous system. And in a scientific sense, acupuncture works because it really stabilizes the peripheral nervous system. Directly after treatment, there's often a sense of tranquility, just really light and open. Those who come in with muscle pain or tightness can leave pain-free or with at least a significant reduction in pain. There's more mobility, more blood circulation. For more of the yin level or the emotional and digestive treatments, there can be this apparent sense of calm in the belly, or a feeling that you're at ease and have higher cognitive clarity. There's this idea to be like bamboo, where things move through you instead of getting stuck in or on you. And I like to think that that's the general sensation of how guests leave the acupuncture table. At least that's my hope.
Like bamboo.
Like bamboo.
I love that. And then you've talked about the importance of, we know our bodies best. We should be doctors of ourselves. I take yoga at home, and the woman I take yoga from, the mantra that she has us repeat is, I am a student of my body, which is a really interesting concept and sounds similar to what you're saying. But how do you've been to Skyterra, you've had the opportunity to meet with you. How do you take this home? Do you find a practitioner at home? Anything you can do on yourself? Should you just plan to move to Skyterra?
Yes. Yes, it's a long con of me just getting people to be here with me. But so regardless of what treatment is chosen, because at the spa there's a menu of items that guests can choose in Chinese medicine. But I will always tell them, this is your diagnosis. Say it's spleen qi deficiency. Or when you think about the spleen channel in Chinese medicine, think about blood circulation and metabolism. If somebody is really wanting that, I want to take this home with me. I need the tools. I feel like I have some of the language, but I need to look at it and revisit it and revisit it. I have this take-home wellness plan that people can do, and that includes their diagnosis, a picture of their tongue with their tongue diagnosis. Okay, there's swelling here. What does that mean? And it's also this color, and it's also in this area of the tongue. I love tongue diagnosis. It's really when people don't know that tongue diagnosis is a part of Chinese medicine, I'll ask them to stick their tongue out. I feel so invasive. They are not ready. Oh my gosh, this is so personal. I didn't know you like that. I didn't know you're going to see my tongue. But the tongue is a micro system, like the hands and the face and the scalp and the foot. There's all indicative of internal health. So they'll get a picture of their tongue and what that means. They'll get an herbal medicine prescription. They'll get a broken down symptomology of this symptom means this in Chinese medicine. Okay, dull, achy, headaches. You're waking up with them every morning, spleen qi deficiency. Side note, that's not always true. It's true in the context of that person. I want to be clear. They'll get nutritional therapy based on that diagnosis. They'll get lifestyle recommendations, a lot of Qigong exercises.
What's a Qigong exercise?
Qigong is Chinese medical massage. So there's these movements that help harmonize whichever channel or meridian is out of balance with medical movement. So it's sort of like Tai Chi, but it's medical because it's based off of a diagnosis. Sometimes it's yoga, sometimes it's breath work. It depends on the patient. And then I'll always say weekly acupuncture 1 to 2 times a week. But when they opt in for those take-home plans, it always comes with a referral from their hometown, or that's wonderful. In their hometown, yeah.
That's wonderful. Dr. Wheatley, this has been so great. Is there anything about Chinese medicine or its relation to Skyterra and our pillars of wellness here that you want to talk about that we haven't covered already?
I think that something that I've noticed that's different with my Skyterra patients compared to my private practice is Skyterra does a tremendous job of reminding our guests that come the importance of coming back home to yourself. And there's this saying that all sickness is homesickness, and home looks different on everyone. And so I am not going to cry, but I am so proud to be in an environment that really brings people home. It is really, really sweet to be with guests who to make that transition here, and an honor to watch it happen.
You are such a gift to our guests and to our team, and we are also honored to have you. Thank you for everything that you do, and also for just being so open with your heart. It really is a gift.
Thank you so much for having me. I'm not crying. I love it here. Thank you.
Thanks so much, Dr. Lou. We'll have you on again.
Thank you so much. Thank you.
Bye, listeners. The Inspired Intentions podcast is a production of Skyterra Wellness Retreat. Special thanks to our executive producer, Alan Broyhill. Send us your questions and comments to inspiredintentions@skyterrawellness.com. Subscribe on iTunes and everywhere podcasts can be found. If someone you know might benefit from this podcast, share Inspired Intentions with them and give us a 5-star rating. Join us next week as we cut through the unrealistic noise on diets and fitness and show you how healthy living fits seamlessly into your already busy life. Thanks for listening.